Hi, I'm Dr. Dayan. I'm thrilled to be here to talk to you about a big part of my practice, something I specialize in, blepharoplasty, or eyelid rejuvenation surgery. This is a procedure in which we improve the appearance of your eyes to put you back to how you looked 10 to 15 years ago. The eyes are the focus of the face. When others look at you, that's the first part of the face they look at, and it's really where we want to direct attention. We want others to look at your eyes. However, in the aging process, the eyes are one of the first part of your face to show that you've been aged. Years of sun, gravity, all these take their tolls on the appearance of your face, especially your eyes. As we age, we start to get a lot of excess skin around our eyes. We may even get dark circles. What causes dark circles? One of the most common questions I get. It may be excess pigment around your eyes. It may be shadowing from fatty pockets that herniate from behind your eyes, or it may be from lots of vascularity around your eyes. And this is one of the things that I'll evaluate that I may have to improve to make your eyes look more youthful. So eyelid surgery is one way in which you can look a lot better, a lot quicker. If others are looking at you and telling you that you look tired, or you don't look like you're rested, and they're not entirely sure why, and you feel fine, it may be that your eyes need attention, and it's something that I can do with a procedure called a blepharoplasty. So how do we evaluate the eyes? Well, in truth, I look at it very closely, and there's many parameters and angles and lines that we've studied as a facial plastic surgeon, and that I also know as an artist, spending years in the terracotta clay studios. But we'll look closer here. What's the position of your eyes? Is it almond shape? Is the lateral portion of your eyelid a little bit superior to the inner portion? In other words, we want a little angle of the eye up, only 2 millimeters, nice crease above the upper eyelid. There's actually segments such as the vertical fifths and horizontal thirds that we look at to see that your eye falls within certain symmetric parameters that would make a more ideal position of the eye. So these are all things I'll measure and talk to you about when I'm evaluating your face. And then I'll tell you which is best for you. My goal is to make other people focus on your eyes. Not on your nose, not on your mouth, not on your ears, not your forehead, your eyes. That's where you want other people to focus. It's a focal point of your face. It's a window to your soul. So during the blepharoplasty consultation, one of the things we can do is put your picture on a computer and give you an idea of what you could look like afterwards. Although not 100%, it really allows us to communicate. I can tell you what looks good and what's possible, and you can tell me what you like. So one of the things that we do is I'm able to make tiny boxes underneath your eyes and lift up the bags and remove them and show you what I can make you look like afterwards. So I can remove the redundant skin, get rid of some of the bags. I use some tools here that then can smooth out the eyes. And this will give you an idea of what you look like. So right in front of your eyes, you can see what your new eyes could look like. And although not 100%, once again, it really allows me to show you what I can do. And it gives you an idea of what you look like, and you can tell me if you like it. You may say, no, I want something different. Less bags, more. And here we go. Now you have two options there, before and after. And this is just a quick fix to show you the improvement that we can make following procedure. And that's pretty close to what the real result will be. So which treatment's best for you? Well, there's multiple approaches to the eye. Sometimes we may offer a non-surgical approach in which we put fillers around the eyes or use laser treatment on the eyes. But for many people really wanting to rejuvenate their eyes, the best option is a surgical procedure. Surgical procedures include upper lid and lower lid blepharoplasty. What exactly do we do in those procedures? Well, oftentimes for the upper lid blepharoplasty, we remove a sliver of skin above the upper eyelids, which really opens up the eyes and gives you an appearance of like you looked 10 to 15 years earlier. For the lower eyelids, we may do what's called a transconjunctival approach or transcutaneous approach. One, which means an incision on the outside, is a transcutaneous approach. If we do such a procedure, we have a tiny incision line that goes underneath the eyelid. It's very difficult to see. In fact, most patients tell me they can't even tell that I made an incision line. It's very hard to see. Within days, it's gone. Rarely does it extend beyond that. If we do a transconjunctival approach, incisions are made on the inside of your eyelid, in which case no incision line is seen whatsoever. The outside procedure is done in order to remove extra skin. So if someone has a lot of extra skin, I may do it that way. Which procedure is best for you will be best determined at your consultation, where we can discuss these different options. I look forward to seeing you at your consultation in which we can talk about this more closely and in further detail. Following blepharoplasty surgery, my patients are thrilled. For the most part, I hear fantastic things from them. They tell me how great they feel about themselves, their renewed confidence. They tried multiple things. They tried lotions, potions, creams. Nothing seemed to work until they underwent blepharoplasty. That was the solution that made a difference. And afterwards, people look at them and say, God, you look good, but they don't know what you did. They just know that you look better. And I'm always amazed that such a small adjustment can make such a huge impact. Remember, your face is focused by your eyes. Everyone looks at your eyes. That's where you want other people to look at. So I will adjust your eyes to make them look more youthful and have other people look at your eyes and focus there. That's the goal of blepharoplasty.
The procedure I had done was I had my eyes done and filler. And I had that done because I was tired of looking in the mirror and looking at a worn out, tired person. I didn't feel tired or worn out. And and when I'd look in the mirror and say, I want to look how I feel. That's when I decided to come see Dr. Dayan. I heard about Dr. Dayan. I believe I saw Dr. Dayan on Channel 7 News, and I just liked his demeanor, and he seemed to know what he was talking about. So I made an appointment, came and saw Dr. Dayan. I chose Dr. Dayan because he seems to have such an easygoing manner, and you feel so comfortable with him, and immediately you feel you trust him. After the procedure was done and everything settled in real nicely, I looked at myself and I said, this looks like the woman, how I feel inside, energized. It was exciting to look in the mirror and see a rested, not tired, worn out person. I knew right after the procedure, there was going to be swelling, things weren't going to look pretty at first. But that was the price, and it was just a short-term price to pay. But once the swelling went down, and the little bit of bruising went away, it was amazing. I really liked my results. It's a type of reaction that people really, they don't put their finger on it, but they'll say, oh, you look really good. Have you been doing something different lately? You look so happy. You look like you're really enjoying yourself. So I'm happy that people really don't notice exactly what it is. I think it's because what Dr. Dayan does, you don't look ridiculous, you look natural, and you look like yourself. You don't look like something that was just stamped out. It doesn't look like surgery. Some people, I have to say, if they ask me my age, they don't believe it. And I don't know if they're just trying to flatter me, but there have been a lot of people who don't believe my age. They'll ask me, what is it you're doing, that keeps you so energized and looking so good? And I find that to be very complimentary. Oh, men? Oh my God, it's been amazing because I get asked out a lot more often, and sometimes it's by men who, are quite a bit younger than myself, so I, try to be careful with all that. But it's enjoyable, it's very flattering. Oh, my confidence is just skyrocketed. It's gone through the roof. I really feel like I can put myself out there and, just say what I have to say. And I've been enjoying this all the way. It's a good ride. My biggest piece of advice is if you are considering a procedure, don't think too much about it, because if you think too much about it, you're going to get yourself afraid. And there's nothing to fear with Dr. Dayan, absolutely nothing to fear. I have total trust in him. So if you go in and just put your faith in Dr. Dayan and stay relaxed about it, I'd say you'd sail right through it. Go for it. Absolutely go for it. I have no regrets looking back. The best decision I've made.
The reason I decided to have the procedures is because it was time to be refreshed. I wanted to have my upper and lower eyes done because of the droopy, saggy skin and the circles. And there were a few little bags, and then Stephen also did my jowls, the neck area. After the procedure, I smiled bigger and brighter, my eyes. I put more makeup on. I'm more confident. After my procedure, everybody noticed that I looked refreshed and thought I was on vacation. What did you do? Is there something different about you? Did you lose weight? Did you change your hair? Did you change your makeup? In actuality, from talking to some of Dr. Dayan's patients is where I made my decision when I came to visit him, and it was about 6 years ago. And I finally made the decision last October to do it. After pondering over and over again, one day I just said, do it. And he did. One piece of advice I would give to other patients that are skeptical about it is to go for it, because it's wonderful.
The one thing I think I would say that describes this experience is I'm just thankful. I'm thankful that I did it. I'm thankful that I found Dr. Dayan. I'm thankful that I found such a great, caring staff, and I'm just really thankful that I did this. I had done forehead lift, eyes done, I had my nose done, I had a chin implant, and I had liposuction on the neck. And I mainly did this because I just never really felt good about my looks, and it's just something I kind of wanted to do all my life, and I got older and just decided to make that change. So before I did it, I was somewhat confident, but I always kind of wanted to be behind the scenes. So, you know, after I had these procedures done, I just felt a lot more confident. I wanted to be out there, you know, in society and doing things and going to social functions, and just, you know, my marriage is better because I feel like I want to do things and get out and just be more sociable, and I just feel a lot more confident and better about myself. So the first time I came to Dr. Dayan's office, I was a little nervous, obviously, just because I had never done anything like this, and he just made me feel really at ease. He's very kind, his staff is very kind, his office is very comfortable, and just, you know, made me feel a lot less nervous about what I was going to have done. Answered all my questions and everything. Everyone was very kind and attentive to my needs, so that experience was, you know, quite easy, and I was comfortable about having the procedures done after meeting him and his staff. So I did do some research before I came in about what I wanted to have done. I kind of did a little bit of research on different procedures and kind of what it would entail and how long it would take to recover and what I would go through before and after, and just, you know, kind of wanted to get a little bit of knowledge. Although I didn't know everything and I had a lot of questions, I did do some research and found out a lot. There's a lot to research on the internet and that sort of thing. I think the most important thing to look for in a doctor when you want to have a procedure done is, obviously, first you want to make sure that they have the credentials, that they are board certified, and you know, they've been in practice for a while, they've done the procedures, they're knowledgeable about everything that they're going to do. And I think, personally, I think that was the most important thing for me, is that he had done this before, and he's been in practice for several years, and he was really good at what he had done already. Actually, right after I had the procedures done, it was a little uncomfortable, but really only for about a week or two, and I was back to work. Still swollen, not a lot of bruising, but I noticed things within a year. I still noticed a year later some transformation. It was really fun to see before and after pictures, 3 months and then 6 months and a year later, and just to notice the change. It was exciting, and as far as you know, right after, there was not a lot of pain. It wasn't incredibly uncomfortable, obviously, somewhat, but you know, nothing that I wouldn't not do it again. I'd do it again in a heartbeat. So after my procedures, most of my friends and family obviously knew what I had done and what I was going to go through, but even the people that knew what I had done always all said that I still looked like myself, but just better. People that didn't know I had anything done would usually just say, well, you look like you've lost weight, or you look different. I can't tell what it is, but you look different, you look good, you look awake. You know, before my procedures, people would always say, you look tired, or you look like you don't feel good, and I never ever hear that anymore. So since I had the procedures done, I never hear anyone say, are you okay, or do you feel good, or everyone tells me I just look so much better. So it definitely changed my self-confidence to have this done. I want to get out there, I want to do things, I want to go. Before I just wanted to stay home, I didn't want to go anywhere, I didn't even want to go to the grocery store. Now I look for things to do and ways to get out and to be out around people. For me, I think that it is important to have the natural results. I didn't want to look like I'd had a lot of work done. I didn't want to look fake, and that's the one thing I am so glad Dr. Dayan he's thinks that it's important that you look like yourself, and that was really important to me. I still look like me, just better, just improved. I think the one thing I would tell someone that wanted to have this done is to, look into it, but even if you're apprehensive, just go for it. It's the best thing that you'll ever do, and it's the best thing I ever did, so I think it's just go for it and you'll be fine. If anyone were kind of on the fence about who they would go to and had other doctors, I would say Dr. Dayan would be my #1 pick, definitely, no questions.